Hi, everyone. I'm Andrea Fletcher. I am the lead data strategist for Cooper Smith. We're helping co-host of the event today. And our speaker for this spotlight session is Toby Norman. Toby is the co-founder and CEO of Fingerprint Technology, a company who builds organizational capabilities to harness technology for real transformation. They've been around for a few years now, and I've always been such a fan of Fingerprint's work. They really do amazing biometric fingerprint scanning technology. If you haven't been able to see it in person, normally we would at a conference. Fingerprint, I just wanted to highlight a couple of awards that Fingerprint has won in the past couple of years because I think it's an impressive list. So they were named TechCrunch's Best Tech-Changing Children's Lives for Good, Fast Company's Innovation by Design, Business Weekly's 2015 Startup of the Year. And Toby himself has been named a Forbes 30 under 30 entrepreneur and social entrepreneurs and a Schwab Fellow. So they have a very, very impressive background. And we're going to listen to him talk about biometric fingerprint technology today. So Toby, I'll hand it over to you.
Wonderful. Thanks, Andrea. And everyone, it's really great to be here. What I'm going to try and do in this session is hopefully not convince you that biometrics is the solution for every challenge within a lot of digital development programs, but try and take us through a couple case studies of very precisely where it can be useful and a few case studies of where it cannot be useful, and try and tease out some things that I hope are going to be really useful for the practitioners in this audience who are thinking about considering biometrics in their programs. So I'm going to share a little bit of content here just so we're all looking at the same things. So fantastic. Hopefully can everyone see that? I'd like to kick us off with a poll. So I know we've got an amazing cohort here attending GDDS. I'd love to know if you've ever worked with biometrics in a development program before. And if so, did it work well? Was it a good experience? If so, maybe it was not a great experience, probably wouldn't recommend it again. Or if not, would you be interested in trying the future or not for you and your programs? I'm hoping that, Nina, you'll be able to throw up the poll for us so we can see it, which should be in the polls tab. Fantastic. We'll just give that a second to go through. While folks are taking the poll, quick introduction to our organization. So, Andrea, thank you very much for the far too kind words. Fingerprint is a non-profit tech company, came out of the University of Cambridge about 6 years ago. What we do is we focus on biometric digital ID for frontline global health and development programs. We're deployed in about 14 countries. We're fortunate to work with a lot of great partners in this space. And really, at the end of the day, what we're trying to help programs do is get really accurate data about who they're reaching. So trying to make a lot more transparency and ultimately effectiveness, making sure that every vaccine, every dollar, every public good is getting to the place where it's needed most. Quick outline for what we're going to cover today. The first thing, and I know this is a digital summit, but actually before we even start talking about technology, let's get really clear together what's the problem. What is the problem that we are trying to solve here? And can biometrics potentially be a solution for that problem? And the answer is not always going to be yes, sneak peek. If biometrics could potentially help solve that problem, what are some of the key considerations before deploying biometrics? I know we have a bunch of very experienced practitioners here in this audience. What I want to do is take us through what are some of the key considerations to think about before incorporating biometrics into a program. Let's get clear first on what is the problem. So what are we trying to solve here? There's a whole number of challenges, but I think at the heart of it, the number one problem that biometrics might be able to solve is contexts where we're throwing a lot of money at programs and at interventions, but aren't ultimately reaching beneficiaries. There's a whole bunch of reasons for this. Let me just take us through a couple cases to understand what this looks like. One of the big challenges we have, for example, in vaccine coverage is the large gaps we see between administrative data. So this is data that's collected by the frontline workers, reported into some type of MIS system, increasingly a digital MIS or EIR system. And then when we validate that coverage with independent surveys, either run by academic institutions or by governments, often with support of WHO and UNICEF, we see sometimes very large gaps between what we think is happening in the front line and actual coverage in program contexts. To give another example from HIV AIDS, there's been a number of instances where programs have significantly cut funding because of incidence numbers getting reported that then don't match follow-up diligence, follow-up surveys, and can often get quite controversial in terms of future development funding streams. Some of these estimates are off by pretty large numbers, over 110,000 in this particular context. One of the things that contributes to this problem, and I think just very practically starting as a research background first at Harvard, then at Cambridge, that I've seen many times, lack of formal ID often makes it much harder for us to get functional ID in frontline projects. The World Bank statistics are about 1 billion people globally lack any formal ID. And that makes it really hard for even very widely respected programs to grapple with some issues that come up in terms of data validity. There's been a number of contexts and it's a difficult subject to talk about, but when we're not getting the quality of data that we're hoping for from frontline interactions and frontline programs, due to a whole complex bunch of incentives, as well as challenges working in really difficult contexts. This has some pretty negative consequences. So for example, there have been instances when I was a young researcher and we're working in Bangladesh, where essential medicines were getting dumped, to hit targets so that what we have as stock would actually match what we had in our logistics management system. And cases where our partners across the spectrum talk about, again, another difficult subject, but filling forms under the tree. And this is all before factoring in corruption, which of course is a big challenge within all of global health, all of global development. It's tough to get accurate numbers on this. If we look at some of the research that's come out of the Center for Global Development, how much aid is really lost to corruption, we see numbers up to 30% of aid funding is just not getting to the intended target at the end of the line. And so this brings us to the problem we're trying to solve. I think it's worth taking a second to recognize that over the past 50 years, we've actually made a ton of progress verifying the efficacy of specific interventions. And so what we mean by that is things like RCTs, difference in difference methods, longitudinal studies, clinical trials, mixed method research. We've gotten a lot more data than we've ever had before about the efficacy of specific interventions. For example, the effectiveness of a vaccine on an individual, the effectiveness of a program at a particular point in time, in a particular context, for example, of deworming pills. What's a lot harder is even if we take an intervention that we have a high degree of scientific evidence that it works, and it works well, making sure that intervention is reaching people consistently, not just at the point that that evaluation was conducted, but all points in the future, it's actually a really difficult thing to do. Broadly, I think there's two buckets that our partners tend to work with. They have management information system data. So this is MIS data, either collected, for example, from digital health platforms, or in some programs, still paper records, and then often supplemented with monitoring and evaluation. And so that, for example, could be coverage surveys evaluating how many people have been reached by a program. There are challenges with both of these. MIS data, like we've talked about, there's a number of incentives and unfortunately a number of challenges making sure we've got the quality of that MIS data that we want. And the coverage surveys and those follow-ups can be great, but they can also be expensive. They take a lot of work to do and they're periodic. They can only give us snapshots. So if we're trying to ultimately get to, as a sector, towards more verified impact in programs, what we're looking for are there ways that we could potentially improve the breadth elements of that equation? Could we get better and better and better at verifying the breadth of intervention? So when we take a solution that we know works, it's been proven to work, and we deploy it consistently, and we've got really high quality evidence that it's reaching everyone it's supposed to reach, we can be very confident then that we're having the impact that we're hoping to have in programs. And that's the question that we've been grappling with for the past 6-7 years now, is what if we could easily verify the breadth of an intervention for every single program? That brings us to biometrics. Most of us, I think, are familiar with biometrics, but when we ask the question, can biometrics be used to solve this problem? we see that broadly there's two buckets of applications of biometrics in the digital development sector. First, let's just be clear what we're talking about. So when we say biometrics in this context, what we're talking about is physical feature biometrics. So these could be biometrics like a fingerprint, biometrics like iris, biometrics like face recognition. There's a number of other biometrics. Voice is used, increasingly in KYC, so know your customer for finance. There's finger vein biometrics. There's even ear biometrics. There's a whole range of biometrics that exist in this space. The most dominant forms of biometrics, at least in the development programs that we see, typically tend to be fingerprint, iris, and face. And there's a couple reasons for that, and we'll talk about them in a minute. What I want to do is distinguish for a second between biometrics that are getting used for foundational ID programs versus biometrics that are getting used for functional ID programs. So a really good example of foundational ID is a foundational ID program is one that's trying to get accurate data for formal government registries. This might, for example, be your equivalent of a social security number, a national identity card, information required to have a passport or a driver's license, or birth certificate. This is an ID, an identity document, that's issued by the government and can be legally used, for example, to access government and other services. The biggest deployment of these in the world is India's Aadhaar UID program. This has now enrolled over 1.2 billion people, which is using a combination of fingerprint, a combination of iris, that's what you're seeing in the photo there, as well as a combination of more recently face biometrics. This is different from what would be considered a functional ID. A functional ID is not a government ID, but an ID that we use practically. And so people who have a lot of experience with data collection platforms, that UID field or that UID metadata, that's the piece of information that it's not a formal government ID, but it's what we use in a program to link to a specific patient or to link to a specific beneficiary. Great example of this, both UNHCR and World Food Programme have been increasingly using biometrics, for example, in delivery of subsidies, cash aid, and other things for refugees and other vulnerable populations. And they've used a combination of fingerprint biometrics, iris biometrics. Here, these aren't government IDs, but they're used by the program to make sure that humanitarian aid is reaching people, and we have a really clean registry. And as many folks know, World Food Programme won the Nobel Peace Prize last year. We're seeing, I think, some pretty amazing data come and some pretty amazing reach data come for these programs, and it's helping try and make sure we have that verified reach of humanitarian interventions. Where Fingerprint is focused is more in the digital health space, and specifically more in mobile biometrics. So I'm going to take us through a couple case studies of what this looks like practically in field context. Broadly, we've worked with two solutions. So the first is we developed a contact-based fingerprint solution. And this we actually started with when Andrea was at Dimagi. I think our first ever deployment was with Dimagi Impossible in Nepal, using fingerprint biometrics to link health workers, to help health workers link mothers to consistent patient IDs over time. More recently, we've been doing work with contactless face solutions. So this is mobile, offline first solutions that work for mobile devices, allowing us still to get that key biometric ID. Very practically, what does that mean? What are we trying to achieve? Broadly, when programs are deploying biometrics, we see two things that they're after. The first is we're looking for that better frontline ID. So this is, for example, a field worker being able to identify a person by their biometrics so they can pull up the right case to do case management, vaccinations, whatever that specific intervention is. It's an alternative to searching by things like names, dates of birth, other identifiers, the household numbers that are chalked on the door, other identifiers that we might use. The second thing we're trying to do is make sure we have better program data so we can see verified reach information in real time as projects roll out and respond. So for example, in a deworming program where we want to verify that every MDA pill is reaching the right person, and in this case, trying to reach them twice in a 12-month period of time, we can see that rollout and use a biometric to be that validation of the who question. With timestamps, then we know the when, and with GPS, like we have in pretty much all the large data collection platforms now, you know the where. And that allows us to build really accurate maps of where and how our program is rolling out. The approach that we take, and I think we're going to see increasingly other partners taking in this space, is plugging into existing platforms and survey solutions. And so this is using a biometric here as a plugin into tools that have already been adopted and increasingly at national scale. So platforms like DHIS2 Tracker, so this is the Android, ComCare, OpenSRP, Survey CTO, and a number of other platforms in this space. And I think one of the nice things about a biometric in this context is it's agnostic to platform. It doesn't really matter what the platform is, provided the plugin's designed well, you can plug into existing solutions. It's a little harder to plug into already deployed workflows, but it's possible if the workflow can get designed well. Taking us through some case studies, so practically what this looks like. One example is we were doing a project studying HIV outcomes in women. We partnered with UNC and the University of Brown School of Public Health. And what we're looking at is, could we track HIV outcomes over time using that biometric, specifically a fingerprint, to be that really accurate identifier for each case? And would that do better than the existing electronic medical record system? We've got some good data from that. I can share the links. There was peer-reviewed papers published in AIDS and Behavior and AIDS Care. Another example is looking at tuberculosis treatments. This is one where you really want to make sure we've got good quality adherence for each TB treatment. And so we're using biometrics to help not only see, do we have that adherence, but also can we separate the data between the prevent contamination between the intervention and the control groups, which was quite exciting in this context. One of the final applications I think is going to become a lot more in the future is obviously going to be around vaccine delivery. So this is a huge topic right now globally. We're doing massive vaccine delivery campaigns, the biggest we've ever done, arguably in the history of global health. And one of the challenges that we're going to increasingly come up against, and place Simprin's fortunes partner with Gavi and a number of programs on this, is can we verify that each vaccine, these really precious, high-demand goods, are actually getting to the intended target, getting where they're supposed to go, so that we can ultimately stop the pandemic. I want to bring us practically, if we're thinking, okay, a biometric might be useful in a program, what are some of the things that we need to get right before deploying biometrics? Like every time that we introduce a new intervention and a new technology, we want to be really thoughtful about where and how we deploy. Unsurprisingly, and I know the practitioners, this is very well understood, but biometrics are not a magic solution to digital programs. If a project is a giant mess, a biometric can help support it becoming a digitized, well-monitored mess, but it's not going to change the fundamentals. So we want to be thoughtful and really clear about what a biometric can do, what it cannot do, and when and how to deploy. Taking us through a couple of details. The first and the most important question, and honestly, after seeing nearly 20 programs in 14 countries at this point, the place where it almost always goes wrong first is not taking the time to really think through that question, are biometrics necessary? And I've given some examples here of places that I think are good use cases and some places that are bad use cases. Good use cases are places where an intervention has some type of value that means it's really important it gets there, it's expensive if it doesn't, and the motivation for having that good quality data about reach exists and is going to be aligning the partners in the programs, from the funder to the prime if it's a large program, or to the NGO, to the technical implementers in the project. Make sure everyone's aligned behind that goal. Similarly, if incentives exist for misreporting, so this could be strong push for impact inflation, whether that's coming from the donor, whether it's coming from the partner, or just a really high and unrealistic frontline worker burden, then biometrics is going to be a better fit to try and reduce misreporting. If the intervention is longitudinal, so for example, thinking about deworming programs that are trying to do multiple rounds of NDA, things like TB, HIV, vaccines, where you really want to make sure that that same person receives the same intervention over time. If the target population has few alternate ID methods, so if they're poor, marginalized, lack formal ID, there's not a widely adopted national ID program that we could use as an alternate. Of course, the intervention needs to be digitally, and the basics of the program are in place and working. couple bad use cases, places where I would strongly advise biometrics probably is not the right fit for a program. First, if the intervention has zero value, and I mean that in zero financial value to the people deploying that intervention. So there's no incentive for it to get stolen. So for example, things like public health messages, leaflets, really, really cheap goods, or medicines. In some cases, probably going to be more cost effective just to really deploy as much as possible and get the coverage, get the reach through that way. If there's alternative mechanisms for verification, so for example, in bednet delivery, you don't need a fingerprint. Take a photo that the bednet has actually reached the place and been put up. That's a better form of verification than just delivery. If the interventions are one-off, I think there's a lot less need. Biometrics are investment. You're trying to set up something complex and do it well in a field setting. Let's be really clear if that intervention is going to be one-off or if we're making an investment for health system strengthening for the future. If there are alternative IDs, if the intervention is not digital, or the program's a total mess, fix the basics first. The second thing to make sure that we're really clear on is a biometric going to be accurate in a particular context? And so, for example, this is a photo of my fingerprint. I won't tell you which one. You won't be able to break into my phone with it. But what you're looking at here, is neat, unscarred fingerprint that spent a lot of time on keyboards, far more than it has doing manual labor. Whereas often the populations we work with when we're doing like a fingerprint biometric, we're working with populations who are deeply worn, scarred, and particularly with women. And we did studies when about 3-4 years ago, collected 135,000 fingerprints from really, really poor, marginalized populations. And we saw, particularly with women, very high levels of thermal burns on fingertips because people in the most remote or the most poor context were lifting hot cooking pots and getting thermal burns on their finger pads, which meant the accuracy of existing market sensors was very poor. We saw equal error rates over 30%, which is just unusable in these contexts. So be very thoughtful if we're going to use a biometric, are we going to be using one that's accurate in that particular context? Second one, and this is critical, are biometrics going to be cost effective? Get really clear on the cost model. A lot of the private sector biometric providers still work on a per transaction basis. I think that's going to change over the next 5 to 10 years, but it's still the dominant model for a lot of payments. Do we have open source APIs and perpetual or evergreen licenses? Are user costs going to decrease rapidly with scale? And as we're thinking about these interventions, do we see a cost curve that's going to fit what the program's trying to achieve? Related to cost effectiveness is also what's the ROI from deploying a technology like this. I think for a lot of programs where they get the best ROI is going to be making sure that they're getting accurate data and reducing fraud across multiple projects or multiple uses of that intervention in the same program over time. And I think there's some great data that's come out of World Food Program and other partners about how much they've been able to save deploying biometrics. That's going to be part of the business case for convincing stakeholders this is the direction to go. Absolutely critical one is local capacity. So biometrics, like all digital development interventions, requires motivated and trained users. There's nothing more that's going to drive the success or failure of a deployment. So making sure that we're really thinking through all of the steps in that intervention. We highly recommend, wherever possible, embedding that into the digital data collection platform, the training for it, the training of trainers for it, the step down, all of those components so the users are having a seamless experience, and we're building local capacity to manage and maintain the intervention after the initial kickoff period. One that's slightly more unique to biometrics around biometric interoperability is what are the right standards? And so within the health data field, we have things like FHIR, and other very well-defined interoperability standards. Within the biometric data field, if you're coming to this for the first time, it can feel a little thorny. So there's a whole number of standards and a whole number of considerations. The most important one is just making sure we're storing data in a format that's going to be defined by an international standard. Storing raw images is good, provided you have the right security protocols in place. If not, particularly if you have size considerations, making sure we're using standards like ISO 1979 4-2, which is internationally recognized standards for storing fingerprint templates, so that if you want to fire a biometrics vendor and bring in a different one into the project, You can do that, and you're not going to have to start all over, start again from the beginning. A second component of interoperability is thinking through how is this all going to plug together ultimately in the system that we're working on. And I think one of the greatest promises of better patient digital ID is that it could allow us to make sure we have the same patient ID across multiple touch points, whether they're geographic, for example, like a clinic, a hospital, a frontline community health worker, or whether they're longitudinal. So for example, a mother who's receiving maternal healthcare services on her ANC visit number 1, ANC visit number 2, ANC visit number 3, we have that consistent biometric following her, or that consistent ID through biometric following her across the intervention. Finally, and this is one I want to talk about, with a little bit of candor in this audience, because I think we have people here who understand this and are going to sort of help us make sure we're doing this as much as possible in these programs. Is there genuinely a feedback loop where better data matters? And one of the challenges that we see in some programs is that even with all the right intentions, we don't have the alignment of stakeholders to have a feedback loop where better data is actually going to lead to a change in program operations, a change in behavior. And if that feedback loop doesn't exist, deploying an intervention like a biometric, frankly, deploying any intervention, digital intervention, isn't going to make a difference. What we've got to be looking for is if we just see a one-way flow of information, strong incentives to just send the best numbers possible back up top, that's probably not going to be the right context where we're going to see the impact results we want. If, however, we're working with partners who are trying to break that loop, and we're really trying to make sure that, okay, feedback is actually feeding operationally into the program and getting better every not just every 2 years once an evaluation is done, but weekly, monthly, even daily if we can, then that's a good place where accurate data is going to yield results and be a good investment for the program. Finally, I'm going to end on this one because it's really critical to get right. It is doable. This is, it's not rocket science, but it's something that needs to be baked into the way biometrics are potentially deployed in intervention. Baseline, choosing to adhere to strict standards. So this should always be local regulation in context. We highly recommend GDPR as a framework that's robust, suits biometrics very well, and even if it's not required by local legislation, is still applicable, I think, for every biometric use case that we've come across. So holding to, for example, GDPR regulation when it comes to storing biometric data, strongly recommend that across programs. Second, make sure we're being really thoughtful in the operations. So for example, are we implementing privacy principles in context to make sense? To give one example of this, we worked with a team of human rights lawyers to design the privacy notices behind Fingerprints to really try and drill down a complex question to 3 simple statements and a very clear frequently asked questions document that can get translated into local context language so beneficiaries really understand what are the data that they're giving. I am so guilty as an individual of accepting cookies and other privacy notices without reading them. And I've had the fortune to receive a fair amount of education in my life. How could we expect someone who hasn't had that to possibly go through a 10-page legal terms and conditions with language that's terrifying and completely incomprehensible? So being very thoughtful about the privacy principles in context. And then finally, wherever possible, advocacy for stronger privacy protections. There's a number of great groups who I think are leading the charge on this. ID for Africa, the World Bank's ID for D Team, ID 2020, and a number of other organizations. If you're interested, shoot me a message and I can put you in touch with some of these groups. But they're doing a great job thinking through what are the right privacy principles for the use of biometric data in digital development programs. So if we're trying to boil it down and be useful, I would say if you're going to do a checklist, just start with 4. Being clear, is a biometric going to be necessary in a project? And if we think it's necessary, is it genuinely going to solve the problem? Do we have the right operational factors in place that this can solve the problem? Which biometric tool is appropriate? Have we thought through the accuracy of different modalities, for example, face, finger, iris? And most important, are we going to be protecting privacy in the use of biometrics in digital development intervention? If we can get these right, I really have a ton of confidence and a ton of optimism that globally and together we're going to do a much better job fighting for verified impact wherever we are on whatever type of project we're working on. Great, let me stop there. If there are any questions, would love to dig into it. Otherwise, happy to expound on a few points or let people go off to the next session. Andrea, back to you.
Hi, Toby. Is my video working? There we go. Yeah, thank you, Toby. That was really, really wonderful. It's nice to see all of the new additions that you guys have added in. I didn't realize you were doing facial recognition. That's fantastic. So we have 2 questions from the audience. If anybody else wants to add in a question, go ahead and type it into the chat and we can have a discussion. I have a few questions as well. I'm happy to ask. So the first question from the chat is about barriers to biometric solutions. A great question. So in your experience, what has been the major barrier to biometric solutions in development projects?
It's tough to boil it down to a single barrier. What I would probably highlight, the ones that I think are blocking the future of biometrics getting used well in development programs. I think it's going to come down to 2 things. First, I think integrations with digital development platforms is still a huge bottleneck. And I've talked to a few partners and a few folks about this. I think there's a ton of potential for open source APIs that can make it really, really easy for data collection platforms or case management, ComCare, DHIS2 Tracker, OpenSRP, Community Health Toolkit, these other integrations, make it really easy to integrate biometrics, because I think what that's going to enable is ease of deployment, speed of deployment to go way up, and cost to come way, way down. And that's quite exciting for us. We love working with some of our government partners on these fingerprint programs, but I think that I'm very excited about the future of things like palm biometrics, face biometrics, for just rapid deployments, strong integrations that can go in quickly. I think that's going to open up a whole really exciting range of possibilities, provided we've got all of those other building blocks that we talked about in the presentation in place.
Yeah,
I think there's exciting stuff coming down the pipeline.
Yeah, I think that's a great point. Many times we try to actually plug the technology together and it just doesn't work because there aren't standards in place, or interoperability is a mess. And so that's a really great point. Okay, so another question from the chat group. From an implementation and security perspective, what would you say the technology is mature, or are there still unknown variables? Vulnerabilities.
Yeah. It's a good question, and I hate to say it, but I think it depends. And I hate to give the waffly answer, but actually I think that is the most accurate. Digital biometrics has existed for over 40 years. There's some very mature biometric markets in things like immigration, security, other applications where this has been around for a long time. And so while I think there's always security risks, these things have also been really well tested, validated, used in some cases for decades. And the key is just staying up with security best practice over time.
Yeah.
That doesn't remove the risk. The fact is that there have been significant biometric data breaches, including with some government programs, including with the US government programs, where I think they failed to implement some really basic best practices. So from a practical perspective, if you're thinking about biometrics in program, 3 things I would suggest getting right. 1, it's so simple. Please do it. Data siloing. Separate out biometric data from demographic patient data and any other identifiers. There's no good reason that with these data sets should be stored in the same database ever. That just doesn't make sense. Randomly generate a unique link, a UID that connects those 2 pieces of information. In many of our NGO partner programs, Fingerprint takes care of that in an entirely separate application. The user never sees it. That application is downloaded onto the device. It includes the security, handles the keys, handles the encryption, handles the syncing. All of that is separate, so that data siloing is literally in 2 different applications. In government programs, we're more likely to do that in the same, but even then, 2 different databases. So I would say it's a simple architectural solution that solves some of the biggest risks, data siloing. I think obviously encryption, number 2, like that, we shouldn't need to say that now, but I think it's good just to remind everyone. I remember when we were starting out in this space and some of the projects we saw that literally had unencrypted patient data sitting on device. Now, I think any modern commercial, case management or digital health tool, that's not going to be the case anymore. But please, for the love of God, let's make sure we have encryption as a basic. The third one, the biggest vulnerability in any program, regardless of whether it uses biometric data or not, is humans. We are the biggest attack vector from a security perspective. We are the ones who make the most mistakes when it comes to security. And so although it's very tempting to cut budgets around training and capacity building, if you don't see a line for security training for staff in a program, that should be a flag. That should be flagged for implementers. That should be flagged for funders. Please make sure those are on budgets, because humans are the biggest weakness when it comes to security. There's technical solutions to all of this, but if we don't have good quality training, device management, all the rest of that, then we're asking for trouble. And that doesn't just apply to biometrics, that applies to any type of digital.
Somebody has to click the update button. Yes,
please, for the love of God, click the update button.
Yeah, great. So I think you actually answered a couple of our questions there from the chat. I think, Chris, I'm going to combine your two into one, hopefully, because I think he got some of that. And this is about working in offline mode, which, I think often everybody just assumes that, everyone in the world has a smartphone and it has connectivity all of the time. And, even I'm in the US right now, and often I'll drive and I'll lose coverage for an hour, right? And it's not, we don't have consistent connectivity. So can you talk a little bit about working in offline mode and how you're using biometrics in an offline setting, or, a low connectivity setting? Because I think that's a great question.
Yeah, absolutely. And when we were coming into this space, actually, I think online only, frankly, was the only way to go. There were almost no offline solutions. We work almost entirely in sort of last mile contacts in sub-Saharan Africa and South Asia. So offline first was one of our key product requirements when we were first developing Simprints. What we do is we mimic the way that now modern, data, digital, and case management platforms do it, which is offline first. Everything can be done offline, including search, including enrollment, including verification, including all the security, the rest of those features. But in almost every single program, once there's access to connectivity, then that data can sync. So that data syncs with the patient record. This allows you to, for example, move patient IDs between different devices. So, for example, we're trying to connect some of the work we're doing in Tanzania at the moment. It's a really interesting public-private partnership where community health workers are trying to connect patient records. That patient record follows the patient to the clinic, and it follows them to pharmacies. And so across those 3 different points in geography, all of it can happen offline, but when there's access to connectivity, we're able to move that. And so we spend a lot of time on low footprint, making sure the compression is there without loss of biometric accuracy. Our engineers have had literally years of fun getting this balance right. I would say still in all our projects today, and I would expect for the next 5 years, offline first is going to be a hard requirement, even though connectivity is getting better everywhere, and that's a great thing. But I think for most of these contexts, offline first is still going to be a hard requirement for the next 5 years.
Yeah, there's a reason some really big software companies don't work offline very well. A lot of apps on your phone just don't work offline. It's a tricky problem to solve. All right, so I'm going to ask 2 questions. If there's any more that are coming in the chat, I think he got a lot of these on security, but I wrote down 2 of my own. I thought one interesting point you were making throughout your presentation was the importance of getting the right use case, right? Biometrics isn't, a hammer that we hit every nail with. It's, a tool in our toolkit, and you have to have the right use case for it. So I'm wondering if there's a use case that your team has identified that you haven't really been able to deploy yet. Is there something, I remember years ago talking about contact tracing, that this was an awesome use case for mobile apps. And now apparently we were right. But is there a use case out there that you think is a really, good return on investment or high value use case that you just haven't seen deployed yet?
Yeah. So there's a few, I would say 80% of our portfolio today still sits within the health bucket. And so contact tracing is a great one. Medicine delivery, so for example, vaccine delivery, distribution, MDA distribution, really good ones. I am quite excited for where I think the intersection of biometrics and digital is going to meet performance-based financing. And I get really excited about this. And the reason is performance-based financing in health is still really hard, because if we're not super confident about the data quality, then it's very difficult to set up the right incentives in a way that's going to incentivize all the partners to do this. Let me try and make this concrete an example. If we are paying, per deworming pill that is delivered to, per child, that can really align the stakeholders in a consortium or program to try and do the right thing. And that, I think, so much of the time, challenges we've seen in projects is that 10 to 20% of logistics, alignment, coordination, and motivation required to make sure we've got the devices there on time. Stuff is getting through customs. We're putting the effort into the training. We're putting the effort into the supervision. These things are really hard to do. And if the different players in the consortium aren't incentivized to collaborate really well on those activities, it's going to be very tempting to protect budget and say, this thing that we need for program success wasn't totally in the proposal and clear on the budget, so it's going to fall through the cracks a little bit. And suddenly we're showing up to trainings and devices aren't there. I am really excited about the potential of performance-based financing to help solve some of that and get that alignment. We're seeing some of the work we're doing with Children's Investment Fund Foundation. I get very motivated about. And I think biometrics can be really powerful in those instances, because now we've got a ton of confidence for the donor, for the government partner, for the technical implementers, that this intervention has reached a unique individual at point A. And suddenly, and I've seen this happen in one program, all the conversations change from, it's not my budget, it's not my responsibility, to, okay, how are we all going to collectively make sure the supervision for this project is amazing, because we're going to get paid if we're hitting these targets.
You're able to verify it.
Potential, exactly.
Interesting. Okay, I'm gonna definitely stew on that one. And then my other question is, I think it's a little hard to avoid COVID-19 right now. It's everywhere we look, and we're in one of the largest vaccine rollouts probably in human history, right? We haven't seen a vaccine rollout like this since smallpox. And so, what are some of the unique challenges that you've seen with countries rolling out COVID-19, vaccines? It's a targeted group, especially early on in vaccine rollouts. And so verifying that these people are who they say they are is probably a pretty critical element of those programs. So what are some of the challenges, and what are some of the successes that you've seen in this type of vaccine rollout?
Yeah, absolutely. Just to give an example, one of my co-founders is Romanian, and she was been back home through some of this, and she was listening on the radio. And the news reported in Romania the other day that up to 40% of kind of the vaccine stockpile that they were deploying for COVID vaccines could not be accounted for, meaning that huge amounts had gone to politicians, friends of doctors, places that we don't know. So it's really hard to track that supply. And make sure it's getting to the intended target and have a consistent and clear record for that. So I think this is going to be a big challenge, and I think it's going to stay a big challenge because COVID vaccine delivery isn't going away. We're likely facing years, including as we prepare for the variants and release new vaccines for those variants. This is going to be something that is going to be with us for years. It's also a huge opportunity to strengthen health systems. And if we're smart, make good investments, they're going to help not only for years of COVID vaccine delivery, but routine immunizations in general. I think the biggest bottleneck we see now is big investments in electronic immunization record systems, at least from our perspective, have really only just gotten going. We're seeing a number of programs, but this is not the standard now. I would say the immaturity of those systems and the lack of nationwide scale of those systems, we've been talking with government partners and working with Gavi on some of these programs. That's still a bottleneck. In some cases, it's still all paper and pen. And a biometric could be a great solution to supporting the accuracy of those records. But if there isn't an electronic immunization record system in place or getting deployed well at that point in time, you can't use the biometric context. So I would say that's one of the bottlenecks. I'm hopeful 5 years time from now, EIRs are going to be standard most of the places we work. But today it's a rate limiting factor. Interesting.
All right. Do we have any other questions in the chat group? still a lot on privacy and security, which I'm sure you're used to hearing that quite often.
Yeah, absolutely. So important. Any other questions on privacy that I can dig into, or security I want to get into? Fantastic. If it's useful, what I'll do is I'll share in the general channel. We actually have produced a number of guides about thinking through privacy in biometric deployments, and thinking through security in biometric deployments. We also, if it's interesting for people, publicly publish on our website data protection impact assessment templates, including some real examples from real projects. This is thorough work. We're talking 148 questionnaires, but please feel free to take those, steal them, use them. You don't need to attribute them back to Simprints, but these are resources we would want out for people if they're thinking about using biometrics, using that technology well, and being very thorough thinking through the privacy and security implications. It's not rocket science. These are solvable problems, but it's something that we need to have right. It's a non-negotiable in projects.
That's really wonderful that you all made that public. I might nerd out and read through it. I know one thing that we've been having a lot of discussions lately on our team, and something that I think is maybe somewhat common, is consent in these situations and how to explain to someone, on the field. So you've got kind of multiple levels as you're dealing with security and privacy and consent, right? You've got your databases and your government systems, and then you have your end beneficiary who's actually getting their fingerprint scan. So I'm wondering if you have any documentation on how you're asking people for consent, or explaining to them what the process is, what data is actually being stored. We've been thinking a lot about different focus groups and how to do peer education, because when you're talking about something like mobile network operator data or app data, it's not necessarily clear. We don't all read the fine print. So I'm wondering a bit more about how you actually translate that very technical, large document down to, a mother who's taking her child to get vaccinated.
Yeah, such a good question. And one of the ways we approach this is we actually worked with some human rights lawyers from the University of Oxford to design what we've come to talk about internally as layered consent protocols. So what do I mean by layered? The challenge with consent as it exists today is that you hit someone with this 10-page legalese, unbelievably complicated, completely, I can barely understand some of these documents. How could we expect someone who's had 3 to 4 years of education in their life possibly get this? Much less making sure that obviously that's communicated verbally, if the person is not strong literacy, all the rest of that. So the way we found that works the best for us is breaking this down is a layered approach, where you start with the top layer, the most simple description possible in plain English or plain local language, and literally 3 to 4 sentences. And we worked for, I can't tell you how many dozens of hours honing this to make sure it's GDPR compliant, but also actually intelligible to someone in a context like this, that they can really get it. Then what happens is there's a place for that questions. If there's any questions, then it goes through into the second layer, which is basically an FAQ protocol. And again, all straightforward language, common questions. That's part of the health worker training and the training of trainers, that health workers have that access to those FAQs, so that if there are any questions from the participant, the patient in the context, then the health worker can take them through those. Then if there's questions from that, then it goes into the full protocols, the full sort of terms and conditions, all the rest of that information. And again, trying to make that simple, but there's also the super comprehensive one. And what we like to do is we actually publish those publicly on the website. We think the transparency is a good thing to hold ourselves accountable. We work with a lot of partners who are happy with that. I love it when partners are up for it. And that allows us then to have that, I think, full rigor of the most, legally compliant, detailed you need, but to be really practical in a field context. And we're lucky a few years ago, won an award from the World Bank for the work we've done around kind of privacy-centered design in terms of consent protocols, because it's a difficult thing to do, and I don't think we get this right anywhere in the world, much less some of the last mile contexts that we're working in.
Yeah, it's something I'm hoping kind of moves forward in the next couple of years as a community, that we figure some of these challenges out, because it is tricky to, I mean, if we can't explain it to a room of people who do this all day, how are we going to explain it to, my mom, for example, right? Because she doesn't understand them and doesn't read them. But I think it's an area where the details are critically important to get right, and you have to spend a lot of time and a lot of money and effort making sure that your language is correct and the way that it's being presented is correct. And many projects just don't have that funding in place, or the timeline to be able to take weeks or months to make sure that the end beneficiaries really understand what they're signing up for. And often it's a step that we rush through just to get the product out the door. But it seems like you guys have taken years to try to get this right. And there's a lot that the rest of us can learn as we're trying to come back and roll out some of these types of projects. I think
plenty more to learn. So I'd love to geek out with anyone on this subject and discuss it further if there's interest. We have plenty more to learn in this space. Thanks, Andrea.
Yeah, I think we're ready to wrap it up. There don't seem to be any more questions coming in. So I'll just say thank you so much. It was really nice to hear everything that you all have been up to, and your amazing team, which is constantly growing. And it's nice to see the expansion of the Fingerprint's work. It's been really, really phenomenal. And if anybody has any last questions, you can put them in the chat. Maybe we can hang out for a couple more minutes, 2 minutes, and then we'll end the session.
Wonderful. Thanks so much, Andrea. Really appreciate it. Great to be here. Great to catch up after all this time.
Yeah.
What I'll do after this is I'll link through a couple of the documents that we talked about, useful for participants, specifically some of those consent protocols, the DPIA text, and a few considerations thinking about deploying biometrics in this space. Our goal as an actor, there's hopefully going to be in a few more years a good, rich, strong ecosystem of vendors and partners working in global health and development, thinking about using biometrics. So we want to be a positive actor in that space. And we're very open, happy to share what we've learned, happy to share what we've messed up, which has been plenty. Always happy to have those conversations. And if we can ever support on programs, just let us know.
Great. So we'll leave the chat open for you to drop in those last few links. And if anyone has any questions, you can follow up with Toby on his email. And thank you all so much for joining.
Fantastic. Great to be here. Thanks very much. Take care.